you're teaching us what we need to know. You are in a lot of ways. You are teaching us. Your generation is not uncomfortable talking about mental health, substance use and addictions in your spaces. We have to catch up. Reducing stigma isn't enough. The services need to be front and center. They need to be available. Not only need to see you guys and what you need, we need to really listen and put that listening into action.
Another episode of the Speak Real podcast, sharing one-on-one conversations. We believe that storytelling is the best way to empower youth and give them the platform to find their voices.
Presented by YouthSpeak. Youth experience, youth voice, youth empowered.
Hi, everybody. My name is Carson, and I'm a youth facilitator and speaker with YouthSpeak, and welcome to the Speak Real podcast. And today's guest is Minister Yara Sachs, MP of York Center and the Minister for Mental Health and Addictions, and
I'm the Associate Minister of Health.
Associate. I was about to say deputy for some reason.
Yeah, it's okay. It's all good morning, Carson. How are you?
I'm good. How are you?
I'm amazing. So it's great to be here. So yes, just so folks who are listening in know, my name is Yara Sachs, and I'm Canada's Minister of Mental Health and Addictions and Associate Minister of Health. And I'm thrilled to be back with you speak again.
Yes, we've gotten to know Minister Yara Sachs from a few different occasions. We've had the opportunity to meet with you in Newmarket, and you were at our recent community event, which was awesome. So yeah, for those who don't know, would you introduce what you do as a Canadian minister?
Of course. So obviously, as the Minister of Mental Health and Addictions, the primary focus of my work each and every day is helping and addressing the needs of Canadians when it comes to their mental health, but also understanding that substance use and mental health often go hand in hand. We use substances in our lives for enjoyment, but we also use them as coping mechanisms. So, they really are together in our lives on a day-to-day basis. But I'm also a mom. So like many parents, and I'm the single mom to two amazing teenage daughters, like a lot of parents, mental health comes up in our house all the time, and I have a front row seat to how young people are feeling in terms of there's a lot of anxiety about the future of the world that we live in. That when you go on social media or when you go on the news and young people today, they're confronted with climate change, they're confronted with global conflicts, and they're also confronted at home with the costs of living, of finding a job, real financial stressors that today young people are grappling with in a much more profound way than perhaps we would have seen decades ago, or they're more aware of it. And we know that that can take a toll on the mental health of parents, of kids, of family units, of communities. So my job as the minister across Canada is to make sure that those services in mental health and substance use are available, that they're accessible, that they're equitable, that we are meeting people where they're at so that they can access those services when and where they need them, because waiting is just not an option, especially when it comes to our young people. So, working with the health systems in the provinces and territories, working with physicians, frontline workers, amazing young mental health advocates like you, Carson, and the folks at YouthSpeak really allows me to do the work that making sure that across the country, we are making sure that mental health is health and part of our healthcare system, and getting that work done with agreements with provinces and territories, with setting up the Youth Mental Health Fund, with setting up the 988, which we'll talk about later. So that's day-to-day life as a minister.
Wow, and that's incredible because I feel like I relate to a lot of those things other than the motherhood piece. But yeah, as someone who li lives in Canada who struggles with addiction and struggles with various other mental health things, it is very true what you're saying, especially about wait times. There's a lot of stress and chaos that can come from being kind of forced to wait for services that you desperately need. I know that I've been privileged in a lot of ways that I was able to get the care that I needed in a timely manner, but that like again, was privileged to get that. It doesn't mean everyone does. Um, and hopefully we are doing our part here at You Speak. But I want to ask you what inspired you to get into politics?
That's such a great question. And I think I've always wanted to be in the role of service. It's kind of it really is part of my DNA to that you can be part of change by really getting involved in the things that you believe in and that are important to you. Um, my first taste or bit by the bug in politics was actually in university when my friend's mom was running to be an MP.
Oh,
And I was, yeah, and I was 19 and knocked doors for her. And here was this amazing woman with four kids who had put up her hand. She had been a provincial member of parliament, so she had been an MPP and decided to run federally as well. And my friend said, "Hey, my mom's running. Do you want to help on her campaign?" And I was like, "Well, what's that like?" And just really getting into understanding we have an amazing political system in this country where it's very tangible for us as citizens of Canada to really be involved in the political process in a profound way. And MPPs and MPs and even local city councillors, they have a direct accountability to their citizens in a way that not all democracies or not all countries in the world work that way. And so when I realized this and how important it could be to be that voice and that advocate of change for my neighbors, for my community, it really sparked a lot of curiosity of what you could do, and also really being able to sit down with people and get through hard questions and look for good solutions. And if you really want to make change, you have to be open to having those conversations and really working together to find those solutions. And politics really allows you to do that in such a profound way. I get excited talking. I mean, I could talk about politics all day of why it matters for especially young people to get involved. A lot of young people are cynical about politics today, and I think it's really an important moment for young people to explore it, get curious about it, ask hard questions from people like me. That's why I love being accessible to people, and especially young people, because we're doing this for you. Like as a mom, I'm doing this for my kids.
right. Yeah, and I can speak from that was where I see people in my life, young people who are getting involved in it and working elections or trying to find people to rally for certain parties or things of that nature. I've seen it growing more and more as I get older. But yeah, especially with like young adults now, there is this level of cynicism that is attached to politics and in general. And I think a lot of people they might not really see the full scope of what the Canadian Parliament does, like things with your role as the Minister of Mental Health and Addiction. What else have you maybe noticed about mental health and addiction care across Canada?
I'm always one to be dead honest. So,
Okay.
um,
I'm ready for it.
yeah, bring it. We know that especially post-COVID and during the pandemic, people for so many, their mental health really became challenged, and we saw a rise. There was just a recent report about the rise in alcohol use and addictions, like really summing up what happened during the pandemic when people were at home and in lockdowns, and there was so much uncertainty. And, just as we open this conversation talking about what people use different substances to cope when their world is uncertain. And we certainly saw that during the pandemic. And as we've emerged from the pandemic, we know that too many Canadians are losing their lives to the overdose crisis. We saw a spike go up. I am glad to share that we are seeing trends going down around the country in terms of overdose, but that doesn't mean that there isn't. I don't think there's a single community in Canada that has been left untouched by the illicit toxic drug supply and the overdose crisis. And for me, that's where we have to make sure that we're working with provinces and territories so that we are scaling care to need, making sure, like we talked about, being accessible, being equitable, and being timely And as a federal government, we can't do this, or federal government and communities, like, you can't work in a silo, right? It can't be that everyone's in the tunnel vision of their communities and being like, head down, we've just got to do this. We need all levels of government to be working together, and we need to make the investments in the people who are on the front lines of this, whether it's health professionals, whether it's peer support workers, youth, mental health workers. Frontline communities are workers, and communities have been telling us what they need. And that's how we as a federal government get to respond. So just this past year, one of the programs that I'm really proud of is the Emergency Treatment Fund, where we decided that we would go, yeah, we launched the Emergency Treatment Fund, where we said to communities and municipalities, sit down, get all your stakeholders together, and talk about what you need,
Mhm.
and then submit a proposal to us, because it gives us information of what's happening on communities in crisis, and it allows us to respond with them in real time. So we launched the first call for proposals in November. We're going to be making announcements soon of communities. And that's one piece of the puzzle. We did it for municipalities across the country, but also Indigenous communities.
Yes,
So we
definitely.
wanted to make sure to catch the whole breadth of what's happening across the country in communities, urban and rural, also remote. And the other piece of that was, as you know, with You Speak, and we've had many conversations about this, was the Youth Mental Health Fund.
Mhm.
So really working with community organizations like You Speak to build out and strengthen the youth mental health services that are available to young people. So whether it's our integrated youth service programs, which, depending which province you're in, so shout out to folks in BC, you've got the Foundry, or if you're in Manitoba, it's Huddle. If you're in Alberta, it's Kickstand. We're building these out across the country. There's 93 already in place. And yeah,
93, that's a lot.
93.
That's
We're,
almost 100.
that's almost 100. But the goal is this, is these are places, centers where they're designed by youth for youth to meet your needs when it comes to your mental health and also your health, like, primary care, counseling, employment counseling, harm reduction, um, accessibility and services and supports. Like, really, Carson, is a young person yourself, and you and I have talked about this,
Mhm.
where you're teaching us what we need to know. You are, in a lot of ways. You are teaching us. Your generation is not uncomfortable talking about mental health. You're not uncomfortable talking about substance use and addictions in your spaces. We have to catch up a lot
Mhm.
of ways. Like, we've reduced the stigma, but reducing stigma isn't enough. It's the actionable services that come to really, if we're going to blow stigma out of the water and get rid of it, the services need to be front and center. They need to be available. And we not only need to see you guys and what you need, we need to really listen and put that listening into action. So that's what I love about the Youth Mental Health Fund, or we have the Youth Substance Use Prevention Program. We launched the Icelandic model this past year, which is also a great program, really meeting youth and community, because we get to work with parents, we get to work with schools, we get to work with young people. And when you bring everyone together in an environment for change based on mental health, it the outcomes are just so much better, because for me as a parent, and I really believe the best thing we can do for you guys is build that foundation of resiliency.
Mhm.
Build that foundation where you know who you are, you're comfortable walking through the world, you can name and say what you want and access it. And when we can do that and make sure that there's high quality services available to you, whether it's on substance use services, mental health services, hand in hand, this is when we know that you guys, our young people across Canada, will thrive.
Yeah, wow. There's so much
There's
there
a lot
I want
there.
to say, but I think I'll pinpoint it to one thing. I was so excited. I don't know if you saw it, but I got so excited when you said harm reduction because again, with addiction, like you can't silo it. You can't just have a one-track mind when it comes to recovery because, well, for one, people are on different substances, but two, different people are going to respond to different things, going to need different ways of coping with things. And like the ultimate goal is reducing the harm and making sure people are not succumbing to their addiction. That's
Right.
really like the primary focus, at least with what I am trying to do with You Speak and with stuff that I do. It's it's really important. Um, and you said earlier that mental health and health, people tend not to correlate to the two. So it's very ironic that you're also the Associate Minister of Health. And how does that role differ from being the Minister of Mental Health and Addictions, and how is it similar?
Okay, so that's a great question. I get asked that a fair bit. I just want to lean in on one thing before we I answer that.
Yeah.
Just to, I'm glad you raised the harm reduction piece because there's a lot of stigma or and stigmatization and polarization around harm reduction. Harm reduction could be handing out condoms.
Hmm.
Harm reduction can be having a conversation with someone of what it means to avoid getting Hep C. Harm reduction can be that saying, if you one drink less this week will help you a lot in your health.
Yeah.
And I think we need to demystify that for people and
Same thing, harm
understanding,
reduction, drinking a soda.
yeah, there you
Like
go.
people like don't notice how much harm reduction is a thing in everyday life. And how I explain it to youth in schools is it's like wearing your bicycle helmet while biking.
Right.
It
Absolutely.
reduces the harm of you injuring your head. It's
Exactly.
it's not just about addiction.
Exactly. And I think it's important to share with young people that it's not about either or, it's about and also
Hmm.
when it comes to harm reduction. When we look at a full range of services, which gets me into being Associate Minister of Health. So I work hand in hand with Minister Holland, making sure that the health of Canadians is accessible and high quality in our healthcare systems, and that mental health is a key part of that, no matter where you live in our country. So really creating that seamless integration of mental health into our healthcare systems makes sense as the Associate Minister of Health, because really our universal healthcare system should truly be universal in the services it offers. But as a woman in health today, it's also, there are real challenges that women face when it comes to their health. I've been very involved with breast cancer screening guidelines and really making sure that women can be advocates for their health in spaces where they're not always seen and heard. And, I say this as a mom in her 50s. I didn't think that the abortion debate would come up again, but here we are. And as the female associate health minister, really making sure that sexual and reproductive health and rights are front and center and protected for Canadian women, young and old, across the country. So they're seamlessly integrated, and working with Minister Holland is just it's such a great privilege.
Yeah, and you're so right. Like there are certain things you didn't expect, and I didn't expect to be brought up in this day and age, but here we are. Like it's an interesting time we're in. And um, throughout your time as minister, you've done a lot of work with health, with mental health and addiction. But what was the one moment that you were most proud of?
I think it was flipping the switch and turning on the 988, the suicide
Mhm.
prevention line.
Yeah.
We're a year in since launching the 988, and we've answered over 300,000 texts and calls around the country. Yeah,
Yeah.
helping people in their hardest moment, and to know that there is a service available 24/7, 365 days a year in the language accessibility that you need. So obviously English and French, but we have Indigenous languages. We have amazing volunteers around this country from every background that you could imagine that are there and trained to be on the line to help save lives. And it it, it was deeply emotional for me to launch the 988. I, like many Canadian families, we've had struggles in our family with mental health and with suicide. And we lost my nephew many, many years ago. And to know that there is now a system in place so that no one is alone in that moment really was such a huge, like, that idea of waiting to exhale. It was like this exhale and joy
Yeah.
to know, like, and this is an incredible national project. There's so many people who really care who want to help people in their moment of vulnerability. And to see so many Canadians across the country stepping up to be a part of it is really something I'm so proud of. And the other is the Youth Mental Health Fund. Again, as minister mom, to know that we're putting a system in place where we are, and we're going to bolster and meet youth where they're at with the things that they need, that we are showing you as young Canadians that we're listening and we're taking action with you to build out a system that isn't a dry doctor's office setting or a hospital, that it's a place that's inclusive and compassionate and that really connects you to community and the services you need is just something that knowing we're lowering those barriers for young people is something I'm incredibly proud of.
First of all, thank you for sharing that. And I'm sorry for your loss. And I'm sorry to say that I can relate.
Yeah,
Um, yeah, it's something that I think people are afraid to talk about.
yeah,
And I'm even questioning what I should say at this point because it's something that's very integral to my story that I don't touch on. For
right.
that reason is that I don't know, it's just one of those things. You got to be very careful with what you're talking about with it. So I guess what I will say in this moment is, again, if you are someone struggling with those thoughts, 988 is there.
Yeah,
You can reach out 24 hours a day, 365 days a year. Please call if you are in a crisis situation. And we're so glad that we've been able to share that resource with youth across Ontario as well.
yeah, you're not alone. That's what it comes down to, being present for people and so that they're not alone.
Mhm. Kind of a just kind of I guess turn the conversation a little bit.
Sure.
I'm sure you know that there's a lot happening in the world and a lot happening in Canada and a lot
Yes.
happening with the Canadian government right now.
Oh, yes.
So, what is one goal that you have in your time left in these roles?
So there are two, I touched on them earlier. I think for me, in the time that I have left as minister, and elections are slated for October this year, but as you know, we're in an unprecedented time in Canadian politics, is what I'll
Yeah.
say. But it's also been an incredibly unifying time over the last few days in
Mhm.
dealing with the US administration. Canadians are really pulling together in incredible ways and digging into a sense of Canadian pride that I think a lot of folks had lost for a while there. And it's really wonderful to see. But for me, that means that I want to harness that energy of coming together and really double down on the emergency treatment fund and really getting into communities to help meet the moment,
Mhm.
really meet the moment in the illicit toxic drug supply and overdose crisis so that communities are feel and are getting the resources they need not to be overwhelmed by what's happening because it's trauma. Losing when communities lose multiple members to overdose, it is traumatic. And one of two things can happen. They can either mobilize or they can succumb to the fear of it and be stuck. So the emergency treatment fund is really there to help communities mobilize to roll up their we're rolling up our sleeves with them and meeting them on the front lines to be able to save lives because that's where we need to be focused. And the other, as I said, the Youth Mental Health Fund is if I have my way by 2035, there will be 400 integrated youth service hubs across this country so that if you're a young person, no matter if you are in Yellowknife or if you are in Iqaluit or if you are in Halifax or in Newmarket, you know where to go.
That's incredible. And I hope that that work is, exceeds your goals and expectations because it is really important work. What advice would you give to anyone interested in working in mental health on the political side?
Oh, that's such a great question. So, if when I meet young people, particularly who like yourself and others in Youth Speak or across the country of youth mental health advocates and peer support workers who are working in this space, like you've already dug deep to know and figure out who you are in this moment, because that can change, right?
Oh yeah.
We evolve over time, but you've made a choice to get to know who you are and share the strength of this, all the strength and wisdom that you've gained on that journey to other young people because it has developed your value system. And those are the key ingredients of good political advocacy is knowing who you are and knowing what you want, not just for yourself, but for those around you in the village you live in.
Right.
So what I say to young people is you are the best advocates in the mental health space exactly by your lived and living experience, exactly by what you're doing. Advocating with folks like me is really the first step in gaining that breadth of knowledge and experience that you can bring to so many spaces, whether it's advocacy, whether it's working for an organization, whether it's advocating with folks like me to really impact policy. It's an incredible way to start. And if you want to go further than that, then come knock doors and get to know
Incredible.
your local politicians.
Yes, definitely. Definitely get to know your local politicians. It's been awesome getting to know you and especially your story and your wonderful analogy.
Oh,
For anyone who's like, what are you talking about, Carson? We had our Speak Up for Youth Mental Health community event on January 9th of this year, and you shared a wonderful analogy at the end of our talk. And do you mind sharing it here for our audience? Because I think people will be mind blown by it.
thank you so much. And I want to say, like, it's my analogy. It came from my first like mental health counselor who I worked with as a young person.
Mhm.
And 30 plus years later, it still shapes my life in the questions I ask myself these days. So she asked me, she said, "Who's driving your bus?" I was like, "What do you mean, who's driving my bus? What bus?" And she's like, "Well, what does your bus look like? Is it like a yellow school bus? Is it like a VW van? Um, what does your bus look like? What is the vehicle by which you want to build out your journey?" And then she was like, "Are you driving your bus or is someone else driving your bus?" Mind blown. And then it goes, I know. And then you talk about who's on the bus with you.
Yeah.
Where are you going? Can you take a rest stop?
Mm.
Can you take a different road than like maybe that one's filled with traffic? Maybe you want another road to go on. The idea of really asking yourself each day who's driving your bus and having that going inside and envisioning your world and how you want to take your journey, I think is one of the most powerful things that I can say to young people because we're giving you the keys with the Youth Mental Health Fund. We are giving you the keys to your bus to shape it and drive it the way you want. Because I know when we do that for young people, you're going to go amazing places. And I'm excited to see all of these journeys, and especially with YouthSpeak and with young Canadians across the country. Go drive your bus. That's why we're here. That's why we're investing in you because we know when you're able to do it in a supported way, you're just you're gonna that Dr. Seuss book. Oh, the places you'll go.
Oh, yes. Oh my gosh. I haven't thought of that book in a minute.
There you go.
That's
So,
perfect. And that again, thank you for sharing that analogy because I mean, every time I hear it, I'm like thinking about it. I'm like, who is driving my bus right now? What's happening with my bus? Is my bus a duck bus? Do I need to make is it just like a little duck on the front? Like I imagine this in like this fantastical way, but it is also like such a great analogy to like really think things through on your end of, what is happening with you. It's a good check-in, and
yeah.
we love a good check-in here at You Speak.
And it also recognizes you're not always driving your bus. Somebody else might be. You might not always be on your bus alone. There's other people with you. But the journey is yours to make in your bus.
Ah, that's perfect. That is so perfect. I think we'll wrap up here with one more question, and it's a simple one. Where can people connect with you?
Ah, yes. So we are on the gram like so many. So you can follow me on Instagram, Twitter, or Facebook at Yaarasaks, so Yaarasaks. And I just say reach out if you've
Yeah.
got a question, if you're curious, if you want to know more about what we do in terms of mental health at the federal level, we are here. And I have to say, a lot of times people say to me, "You have such a tough file with mental health and addictions. And I have to say, when I get to sit down with folks like you, Carson, I love my file because there are incredible people like you and You Speak and so many organizations that are showing up for young people across the country every single day. So reach out and get connected and know that you can drive your bus.
Yes, definitely. We will have all of your links in the description of this video. So if you are on YouTube watching this, check out the description, connect with Minister Sachs. Thank you so much for taking time out of your busy day to speak with me and speak with us. We really appreciate it. Thank you to TD for partnering with us on our IG Live and podcast episodes. And of course, make sure that you like, subscribe, share, do all of those things. They really help support what we do here at YouthSpeak. And again, thank you so much for speaking with me today. And we'll see you all next time on the Speak Real podcast.
Thanks, everyone. Have a great day.
Thank you, TD, for partnering with us on our IG Live and podcast episodes.
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth-led projects, visit us at youthspeak.ca, where you can donate and spread youth mental health awareness.
YouthSpeak Charity. Speak, inspire, change.